Madam President, this week the Senate will vote on two bills that will protect our most vulnerable citizens, literally our babies. The first bill we'll vote on is the Born Alive Abortion Survivors Protection Act, which was introduced by our colleague from Nebraska, Senator Sass. This legislation is simple and straightforward. It requires physicians and healthcare providers to treat babies who survive an abortion with the same life-saving care that other infants born at the same stage receive. Well, you might be forgiven for wondering, why would we need such a bill? Surely that standard must already exist in our law. Unfortunately, no. There are no federal laws requiring healthcare providers to care for abortion survivors just as they would for any other infant in their care. And one of the most notorious reasons why we need this law sits in the governor's mansion in Virginia. About this time last year, our country was shocked and outraged by comments made by Governor Ralph Northam, a pediatrician, believe it or not, about what should happen when a baby is delivered and survives an abortion. He said, quote, "The infant would be delivered, the infant would be kept comfortable. The infant would be resuscitated if that's what the mother and the family desired. And then a discussion would ensue between the physicians and the mother. Rather than immediately doing everything possible to save the baby, to provide the same sort of care you would to any infant, he wants to sit around and decide whether the baby will live or die. That is not health care, that is infanticide." And voting for the Born Alive Abortion Survivors Protection Act is how each member of this chamber can go on record to say they are against killing innocent babies. While some are desperately trying to paint this as an anti-abortion bill, which would infringe on women's reproductive rights, those claims could not be further from the truth. There's nothing in this bill about limiting access to abortion, no mention of first, second, or third trimester abortions, nothing about overturning Roe versus Wade. There's one goal with this legislation and one goal only: to give every baby a fighting chance. Now, in a rational world, we wouldn't be having this discussion, but would rather unanimously be condemning this practice for the evil that it is. I'm proud to be a original co-sponsor of the bill and once again to vote to stop the practice of infanticide and protect babies who survive abortions alive. Madam President, we'll be voting on a second bill which would provide protections for unborn children that are practiced in almost all of the civilized world. This is the Pain-Capable Unborn Child Protection Act that would make it a crime for doctors to perform abortions on unborn babies at or beyond 20 weeks. There's significant medical research that shows that unborn children at this stage experience pain. At 5 months into a pregnancy, these babies are beyond halfway to delivery. One of President Trump's guests at the State of the Union a few weeks ago was 2-year-old Ellie Schneider, one of the youngest babies to survive in the United States. Ellie was born at 21 weeks and 6 days, just 13 days beyond the point in time we are discussing. She weighed less than a pound at birth and is living proof of the medical achievements and advancements that have improved the chance of survival for extremely premature babies. Ellie and her mother, Robin, are an example of the impact this legislation would have on the lives of many American families. Unfortunately, just as our Democratic colleagues have tried to deceive the American people about the purpose of the Born Alive Abortion Survivors Protection Act, they're trying to mislead everyone about what this bill would do as well. First, this bill would apply only to elective abortions, not those involving rape or incest or where the life of the mother could be in danger. And it in no way places the mother in legal jeopardy for seeking an abortion. it clearly and solely places responsibility on healthcare providers. Passing this legislation wouldn't make the United States an extreme outlier when it comes to abortion practices. In fact, it would put us in line with international norms. Currently, only 7 countries in the world allow elective abortions after 20 weeks. One of them, of course, is the United States, and the other countries on the list should make all of us second-guess allowing abortions beyond 20 weeks. China, Vietnam, North Korea, countries with a history of human rights violations are hardly the model that we should aspire to. It's time to give every baby a chance to live and stop doctors from performing abortions on infants that feel pain. I'm proud to be a co-sponsor of both of these bills and stand with my colleagues in the fight for human life. Our friend from Montana, Senator Daines, established the first ever Senate pro-life caucus to fight for the rights of our most vulnerable citizens. A couple of weeks ago, he said, "These back-to-back votes will present an opportunity for Senate Democrats and all of us to show the American people whether there are any limits at all to radical abortion extremism." Well, we'll soon learn the answer. I appreciate our colleagues, Senator Sass, Senator Graham, Senator Daines, for their leadership on this legislation and for consistently fighting for the most vulnerable among us. I will be a proud vote yes on both of these bills, yes to protecting newborn babies, yes to equal medical care for all infants, and yes to a fighting chance for all babies. Madam President, on another matter, we are returning to Washington, D.C. from time spent in our states, and I was happy, for one, to get time to spend in Texas with constituents. And I traveled the state, as I'm sure many of us did, traveling their states, from Midland to Fort Worth to Corpus Christi and a number of spots in between. Texas is a pretty big place, so it takes a little time to move around. But it is really a great thing to be able to hear from the folks I represent, the folks we all represent, about what they care about the most. And one of the most interesting things to me is how little they talk about what's talked about inside the bubble here known as Washington, D.C. In San Antonio, for example, I met with state and local officials to discuss their growing concerns over coronavirus. Lackland Air Force Base is one of the designated locations where Americans evacuated from overseas with suspected exposure to coronavirus are being held under the first federal quarantine in more than 50 years. Folks naturally were concerned about the fact that these evacuees are being transported to were scheduled to be transported to local civilian hospitals for testing rather than remaining on the base where they are quarantined. In our meeting, we were able, not only the mayor and 2 council persons, but we were able to speak with officials from the Department of Health and Human Services and the Defense Department about these concerns, and I'm glad we were able to come up with a better solution. The Department of Health and Human Services has now updated their protocol to ensure testing for coronavirus will be conducted at Joint Base Lackland's quarantine housing. So evacuees will not be tested, will not be sent to hospitals in the area for their tests. I appreciate my colleagues at the city who've been working overtime to keep their residents there safe, and I'm grateful to the administration for addressing our concerns and being responsive to those questions. On the very day we met, 90 evacuees were released from quarantine, and I'm happy they are finally headed home. I'm sure I'm not as happy as they are after being quarantined. We owe a huge thank you to the medical professionals who have and will continue to care for those in quarantine, and to the Bexar County and San Antonio officials who are working to safeguard public health. On a different topic, up I-35, I was in Fort Worth at the Northside Community Health Center to hear about an entirely different healthcare challenge, that's high prescription drug costs. I met with local healthcare professionals, advocates, and patients to hear about their experiences with these rising costs, and I've introduced legislation to address them. For example, we heard from Randall Barker and his daughter Emma, who both have diabetes. So they need insulin. One bottle of insulin, they told me, costs upwards of $281. So Randall continues to make sacrifices to afford the life-saving drugs he and Emma need to lead healthy lives. As I mentioned, to address the high costs of prescription drugs, I've introduced a bipartisan bill with our colleague Senator Blumenthal from Connecticut called the Affordable Prescriptions for Patients Act. The purpose of the bill is straightforward: to stop drug companies from gaming the patent system to keep their profits high. Patents, of course, are something that are granted to innovations, to scientific innovations, in order to encourage more of them. And what happens under a period of a patent is whatever the item is, in this case a drug, that company reserves the right to sell it exclusively without any competition in order to recoup their costs and incentivize the innovation when it comes to these drugs. But when companies game the system by establishing patent thickets, multiple patents used to unfairly block competition, this prevents these new drugs, as well as competing drugs at a lower price, from entering the market. For example, the most widely prescribed drug in America is called Humira, and it has more than 120 different patents for no real purpose other than extending that period of exclusivity as long as possible to continue to make money. In Europe, there are 5 competing products, but in America, only Humira. That's a patent thicket. That's gaming the system, and it's hurting American consumers. So I appreciate the support from healthcare providers and advocates and patients I heard from in Fort Worth, and they encouraged us to get our work done sooner rather than later. By the way, I've come to the floor twice and asked unanimous consent to pass the bill that was voted unanimously out of the Judiciary Committee, and the Democratic leader has blocked it both times. I hope he'll reconsider his position. I'm sure his constituents in New York would like a little bit of a break when it comes to prescription drug costs, but I have to think it's more has to do with the upcoming election than it does the merits of the legislation. I traveled to a couple other Texas cities where I was able to talk to people about the rise in e-cigarette use, particularly among teens. In Corpus Christi, along the Gulf Coast, and in Odessa, in deep West Texas, I met with a range of local officials, health professionals, and community advocates about the impact of teen vaping. One study found from the Permian Basin, which is in the Midland, Odessa area, found that about half of high school seniors had used e-cigarettes, and 25% of them had vaped in the past month. This study found that in schools, the average age of first-time e-cigarette users is just 13 years old. Now, e-cigarettes, even the closed systems where you can't add other ingredients like the psychoactive ingredient in marijuana, THC, even in the closed systems that are designed only to deliver nicotine, nicotine is an addictive drug. And when children get access to these addictive drugs, it may well end up being a gateway to other use, whether it's tobacco or other drug use later in life. But certainly it encourages them to remain a user of this nicotine delivery device. So I've introduced legislation called the Preventing Online Sales of E-Cigarettes to Children Act, which would make it difficult for children to get their hands on these devices, particularly when they buy them over the internet. All it does is apply the same safeguards already in place for online purchases of tobacco. It applies that to e-cigarettes. Customers have to verify their age at the time of delivery, a practice which, shockingly, does not currently exist. A recent survey published in the American Journal of Health Promotion found that 32% of underage e-cigarette users reported purchasing products online, making online sales the single largest source of purchases for underage users. We just recently raised the age from 18 to 21 to get access to these e-cigarettes, but still, as these studies indicate, use of e-cigarettes and vaping devices is epidemic in our middle schools and our high schools. And it's dangerous to the physical and mental health of our children, something you would think that we would be able to address. If we're going to turn the tide on e-cigarettes and prevent more young people from facing their deadly health consequences, this passage of this legislation is a necessary first step. And finally, Madam President, when I was home in San Antonio, I was able to help celebrate the investiture of one of our newest federal judges, Jason Pulliam, who filled the final remaining vacancy in the Western District of Texas. Then I got to spend a little time in Midland with folks and talk about the importance of our oil and gas industry and why innovation in that space and concern about conservation and the environment were not mutually exclusive. At each step along the way, I was able to hear from countless other Texans about changes they'd like to see coming out of Washington. And they encouraged us to try to work together and avoid some of the partisan gridlock that we've seen that characterized so much of the recent impeachment proceedings. So it was a great week recharging at home, and I came back ready to get back to work. Madam President, I yield the floor, and I'd note the absence of a quorum.